What is postpartum depression? A question that may have crossed your mind, especially if you're a new parent or if you're close to someone who is. Postpartum depression, often abbreviated as PPD, is a type of mood disorder associated with childbirth. It's a condition that can affect anyone who has just given birth, causing feelings of extreme sadness, anxiety, and exhaustion. Now you might wonder, what does postpartum depression feel like? It's not just the common baby blues. It's a persistent feeling of sadness or emptiness, often accompanied by mood swings, difficulty bonding with the baby, and even thoughts of self-harm or harm to the baby. Who can get postpartum depression? It's important to remember that postpartum depression can affect anyone who has given birth, regardless of gender, age, or socioeconomic status. It's not a sign of weakness or a character flaw. It's a serious mental health condition that needs attention. When does postpartum depression start? Can it start later? Yes, it can. While it often starts within a week or two of childbirth, symptoms can appear at any point in the first year after giving birth, and yes, it can come and go, with good days and bad days. Why does postpartum depression happen? It's a complex interplay of physical, hormonal, and emotional changes. The abrupt drop in hormones after childbirth, combined with the stress, lack of sleep, and the pressure of caring for a new baby can all contribute. How is postpartum depression diagnosed? A healthcare provider will typically use a depression screening tool and may ask about your feelings, mood, and thoughts since giving birth. How is postpartum depression treated? Treatment options include hormone therapy, antidepressant medication, and psychotherapy. It's crucial to reach out to a healthcare provider if you believe you're experiencing symptoms of postpartum depression. Does postpartum depression affect relationships? Yes, it can strain relationships with your partner, family, and friends. It can cause you to withdraw and struggle with connecting to others, including your baby. Can postpartum depression affect the baby? Unfortunately, it can. Maternal depression can affect a child's development and behavior. Will postpartum depression go away on its own? It might, but it's risky to leave it untreated. With appropriate treatment, most people can fully recover. What is postpartum psychosis? How is it different from postpartum depression? Postpartum psychosis is a rare but severe mental illness that can occur after childbirth. It involves the rapid onset of symptoms like hallucinations, delusions, and severe mood swings. Unlike postpartum depression, it's considered a medical emergency. In closing, postpartum depression is a serious condition that can have profound impacts on a new parent and their family. Recognizing the signs, seeking help, and spreading awareness are critical steps towards better mental health. And remember, with the right help and treatment, recovery is not just possible, but probable. So that's a wrap on our discussion about postpartum depression. Remember, you're not alone, and there's always help available.